Welcome to Empowered. I'm Elizabeth Namovsky. As we get older, our risk of getting dementia is higher, and this is something that many worry about. Did you know that twice as many women get dementia as men do? Today, we're going to discuss the important topic of our aging brain and inflammation. And are we genetically predisposed to accelerated brain aging? Today, I'm joined by Jasmina Boban, Assistant Professor, Neuroradiology, Fellow, Vojvodina Institute of Oncology, Faculty of Medicine, University of Novi Sad, Serbia. Jasmina, welcome to Empowered.
Good evening. Actually, it's for you, it's good afternoon. And thank you very much.
I am so excited to speak to you. You and I met we've been talking about this for 10 months now. So what I want to do is begin this amazing conversation. How does the brain age in normal aging?
Well, as far as we know, it ages globally. So it means that the whole brain is getting smaller, our neurotransmitters are getting lower, and the whole function, especially the executive function, so the higher cognitive functions, are getting slower down by aging. And it's normal, it's physiological, and it's something that we will all go through with our aging.
So Jasmina, when does this start? You said, as we get older, is there a specific age that this begins?
It is a very interesting question. They say, as when I was at medical faculty, then they said that the aging of the brain starts after the age of 40. Today, we know that this is actually individual. So this initial point when your own brain starts aging is actually somewhere in between 25 and 50.
Wow, that's so much younger than what we've known or heard of, because when you talk about dementia or aging or an aging brain, you're usually thinking of somebody who's in their 70s or 80s.
That's true. That's an important point that you raised. Actually, your brain starts aging ages before it is actually evident. So your cognitive impairment, the cognitive slowing, starts after some time. So the brain starts aging, and then it's actually compensated in a way. And then after several years or several decades, it begins to show. So your cognitive functions begin to decline, and you're entering the stage where it's obvious by yourself and by your environment that actually your brain is aging and slowing, and that you're entering a phase of mild cognitive impairment.
So we were talking about inflammaging. What exactly is that?
It is a new term. Actually, it was introduced several years ago, and it is a combination of inflammation and aging. Now, what we know is that if we have systemic inflammation, for example, in obesity, or in some kind of chronic viral infection, or associated with malnutrition, with alcohol abuse. So these are all the things that make our body inflamed, but only at a low level. This actually reflects into your brain, and it makes it age a bit accelerated. So the whole cascade of brain aging starts earlier and goes much accelerated compared to normal physiological healthy, as we say, brain aging.
So how does the brain age in those various inflammatory processes, such as viral infections, post-COVID, or obesity?
What we know now is that our brain ages in similar way associated with inflammation. So the first, let's say, spots that are hit are actually our old brain. So the limbic system, the part of the brain that is associated with emotions, with memories, with a system of the appraisal, of the rewarding, and this is the part of the brain where aging actually starts. It is unfortunately connected with our thalami, with the part of the brain that is deep inside the brain, and that actually triggers our own voluntary and also involuntary actions. So
Okay.
This is the part that starts first.
This is fascinating. And I know so many people right now that are being affected by this, whether their parents are 70 or 80 or their spouse is 60. We're all being affected by it. So please don't go away. When we come back, we're going to delve a little bit more into what Jasmina has been researching. So please don't go away. We'll be right back.